is to find all the missing cases, TB cases. Find the cases, link them to treatment and care, and ensure that what we are doing, we do it with quality. So in terms of results, what we found in 2019 was that we were able to increase our TB notification like around 10% comparing to 2018. We were able to notify almost 100,000 TB cases, including 1,300 MDR cases and around 14,000 childhood TB cases. We were able to focus on high-risk groups. We have the minors, a huge population of minors and ex-minors. We have a program to screen the healthcare workers, and we were able to screen more than 31,000 healthcare workers for TB. Now our treatment success rate in Mozambique for sensitive TB is 91%. It's the expected number for 2022 by WHO. So we already reached the 90% for sensitive TB. When we look to MDR, the treatment success rate is still low. It's around 60%. But for us, it's an achievement because we are coming from 47% in 2018. For 2020, what we have in our plan is mostly to consolidate the interventions, to continue to support the simple transport system, to continue to support the gene expert and digital X-ray utilization, to screen people and to screen and test people for TB, and also to improve the services provided in the perspective of occupational health.
In 2019, we had a number of successes that we registered in this project. Number one is that we have established a very strong system, cross-border surveillance system with our neighboring countries, Mozambique, Zambia, as well as Tanzania. The second area that I can also look at is the issue of screening among minors and ex-minors. We have gone to the communities and also made sure that we're engaging the artisanal small-scale miners so that we give them information and also making sure that we are screening them for TB. Moving forward into 2020, we have also ambitious plans. Number one is to make sure that the cross-border disease surveillance continues and we expand it. Number two is also to increase still issues to do with case notifications. We will delve into better diagnostics as well as giving out information to the people so that they seek care. Finally, we also make sure that occupational health and safety is also given prominence. We look at the legislation that we need to develop and maybe review. There's a prominence and an issue of giving a strong emphasis on establishment of occupational health centers in Malawi, and for 2020 we expect that this will be a reality.
Malawi has had a number of achievements in 2019, such as successful coordination between the three sectors: health, labor, and mining. Malawi has managed to use over 90% of its resources, which has gone into providing X-ray and equipment units to most program areas of the SATBHSS project, as well as increased volunteering and community involvement regarding case identification, which has shown a tangible impact. There has been an increase in engagement with the Labour Ministry and civil society around TB in the mines. There's also been an increase in involvement with the private sector regarding addressing occupational safety and health issues in the mining sector.
This project has helped to actually, first of all, highlight the plight of miners and ex-miners in the fight against tuberculosis. In 2019, I can specifically make reference to the success of reaching more miners and reaching more ex-miners in terms of, first of all, diagnosis, but also treatment. And what we see going forward in 2020 is the fact that there will be more people that will be reached. Zambia, and based on its demography, has certain miners settled in the rural areas. And in 2020, we see the project reaching more of those and just helping out all those that are at the threat of getting tuberculosis. But 2020 also offers another opportunity of us reaching especially the artisanal miners. We have concentrated so far on a lot of miners that are in the formal mining sector, but we have a lot of artisanal miners who are also vulnerable to contracting tuberculosis. And in 2020, through the project, we should be able to reach a lot more so that we just have a safer Zambia. I thank you.
The government launched the Community TB Care program so as to intensify the TB case detections as well as coming up with the TB treatment successes, whereby we do involve the two districts, being the district of Berea and the district of Leribe. So in doing that exercise, we were using the mobile digital X-rays tracks, whereby the high vulnerable groups or the high risk groups, such as the people with HIV positive, ex-minors, prisoners, as well as the children under the age of 5 years, were screened using the mobile digital X-rays. By bringing closer the services of mobile X-rays closer to the communities, it is improving the yearly detections of the burden or the TB cases, as well as putting at early stage those identified on treatment as soon as possible. So the plan for this year, which is 2020, as the government of Lesotho, like I earlier indicated, that we started by piloting for helping a country a lot to even improving more or further in decreasing the TB cases in Lesotho.
The Southern Africa Tuberculosis and Health System Support Project is a regional project launched in 2016 with the aim of strengthening the health sector's response to tuberculosis and occupational lung diseases. It is implemented in 4 Southern African Development Community member states: Lesotho, Malawi, Mozambique, and Zambia. The African Union Development Agency (NEPAD) and East Central and Southern Africa Health Community (EXA) collaborate to provide technical support in project implementation in the participating countries. The project, which is funded by the World Bank, contributes to regional, continental, and global frameworks on tuberculosis, such as the SADC Strategic Framework for Control of Tuberculosis, the Catalytic Framework to End AIDS, TB, and Eliminate Malaria in Africa by 2030, and the WHO End TB Strategy, respectively, amongst others.